Now imagine having to spend more on travel to hospital than the cost of that treatment that you're seeking. This is a harsh reality that confronts villagers in the numerous islands of Lamu County, where a patient can part with a sum as much as 10,000 shillings one way to hospital to another island. But as Kaschana Masha found out, a medical camp conducted monthly by Safari Doctors, a non-governmental organization, could be the only access to medical services for hundreds of these villages.
Early morning at Faza Island in Lamu East Sub-County, Lamu County. A team of Safari Doctors offload equipment and drugs from a dhow to a speedboat en route to Kiwayu Chandani Island. A speedboat reduced the hour, although would have taken to just 15 minutes. At Kiwayu Chandani, villagers come out of their makuti-thatched houses and converged under a baobab tree, anxious at the arrival of Safari Doctors. In an area where hospitals are scarce, this once-in-a-month medical outreach is a savior.
Na hii kijiji ni kijiji ambacho inaitwa Chandani na iko kando na mji yote. Kwa hivyo usafiri pia ni ngumu kama ni Lamu. Sisi tunagaramika kwa ukubwa.
Mimi nakwambia hapo ni mgonjwa wa sukari. Unaona? Kwa hivyo ndio mimi usaidizi wangu napata dawa hapa kwa Safari Doctor za mwezi. Mpaka utakapokuja tena ndio mimi nipache tena madawa.
We take another speedboat ride to Medina, and although it took only 5 minutes, nightfall can worsen a medical emergency here.
Wakati wa usiku sasa, hapo ndo kuna kizaazaa. Kama unashikwa na ugonjwa hapo kwa ya kigafla ni mpaka asubuhi. Hatuna pikipiki, hatuna lolote hapa.
But that is not the only challenge for this Boni community.
Tuna shida ya network. Kuna NPR, mimi wa kwanza ni NPR. Ni mfanyaji wa serikali, ni macho ya serikali. Sasa pia hata mwingine unaweza tokea dharura, siwezi jisaidia kwa simu.
Our next destination is through the mangroves to Kiangwe, a small village also within Boni Forest. The only dispensary here cannot cope with its growing population, and for pregnant mothers, Fatuma Shizo, a home-based midwife, is their only hope during such emergencies.
Nikiona shida ndio napiga simu kwenda kumpeleka Lamu au nitamleta hapa, dokta mwenyewe apige simu tuletewe ambulance pelekwe Lamu.
Pregnant women who attended the outreach were lucky to receive scanning services. The cost for this mode of transport is prohibitive, especially when one seeks special treatment all the way to Lamu town and the King Fahad Referral Hospital.
Ukienda na slow boat kutoka Lamu mpaka Kiwayu ni masaa kama 4 kwa slow boat, lakini speed boat kutoka Mokoe kutoka Lamu mpaka Kiwayu ni masaa 2.
Besides humans, the Safari Doctors medical camps have benefited animals, mostly donkeys, which are the common means of transport in Lamu.
We always do vaccinations according to their regimes. We have rabies, which is a very big problem in Lamu, where they are mostly animals attack human beings, especially the children. So hapo watu tunafanya vaccination so that we avoid the spread.
Safari Doctor kila wakati naleta punda hapa nyumbani hapa, wanakuja wananitibia, wananidungia, wananipatia dawa ya minyoo. Sasa mimi naona ni vizuri ya kwamba ukiwa ni gharama ningeenda Lamu.
As such, this medical outreach by Safari Doctors is such a necessity.
Lamu is a unique space. Actually, for Lamu particularly, the issue is transport. Na ndio maana tukaitwa safari. Si safari ya kwenda Mara, it's not a luxury safari, ni safari between life and death. People don't believe when you say you have to get on a speedboat, na ni like almost 1,50,000 if you're hiring for an emergency.
So many people in Lamu have benefited from this initiative.
10 years later, we are 18 staff, a few thousand patients a month. Incorporated also an education model, youth health ambassadors. Na hiyo sasa hivi ndio msingi mkubwa, like vijana lazima wawe kipao cha mbele katika masala ya afya. If you're talking reproductive health, if you're talking peer pressure, if you're talking, you know, that critical age, early pregnancies. So we can't be talking about reproductive and maternal health if we're not using youth on the front line of community health workers.
The exercise complements government efforts to attain universal health coverage.
Let's really be intentional around designing healthcare model that goes all the way to that pastoralist ambaye yuko na ninio na ufugo wake, all the way to that mother who can't get on that speedboat to access emergency healthcare.
Amid the excitement over the Social Health Authority, for Lamu East residents, their concern is how this new health scheme will address their unique challenges in availability and access to medical services. Transport from one island to access quality health service at the referral hospital is the greatest challenge for a section of residents in Lamu County. To attain universal health coverage, Safari Doctors is appealing to the government to include mobile health service delivery. Reporting from Lamu County for KBC Channel 1, my name is Kasichana Masha.